The purpose of the National AIDS Council of Zimbabwe, as enacted, is to provide for measures to combat the spread of HIV and AIDS, and the promotion and coordination and implementation of programs and measures to limit and prevent the spread, and to provide for matters connected with or incidental to the foregoing. I want to point out that this new board, we expect that this new board will be able to work closely with ourselves as the ministry. We trust that the board members will be able to do the best that they can, the best of their capability, so that the National AIDS Council board will be one of the most effective in providing the measures to combat the spread of HIV and AIDS. We realize that the board is taking over after the last board had tried its best, and we want this board to do better than the last board. We are very grateful for the services that were provided by the previous board, and now it's time for us to have new kids on the block. And I'm very happy with the composition of the board members of the board. The capabilities will show for themselves, and we want to give them the opportunity to be able to perform. But one of the most important things that I would like to discourage amongst the board members is gossiping. Let us not gossip. Gossip kills. Let us work as a unit. Let us have a unit of purpose, so that we build a formidable system in Zimbabwe in the prevention of the spread of HIV/AIDS. I want to encourage the board to also think outside the box, not to just wait for ministry to give directives and to be given directives. I want you to also think for yourselves and come up with strategies, come up with projects, so that we can be able to contain the problem in Zimbabwe. So that we can be able to ensure that we've got adequate availability of antiretrovirals and all the other medicines and the equipment that is required, in the management of HIV/AIDS. So you are there not just as a baby of the ministry, but we want you to be a grown-up baby. We want you to be grown-up child of the ministry, so that you can be able to also fend for yourselves, rather than just coming back to daddy and asking for more. That is what we want to see. I want to see all of you working together, and I'm very happy at this stage to also say I'm very happy with the nominations and elections that you have carried out in my presence, where you have chosen Mrs. Margaret Mejo Makulu as the chairperson of National AIDS Council of Zimbabwe. I think let's give a big hand of applause. And you can stand up so you can see. This is the new person, the new chairperson. We'll ask you to say a few words later. And at the same time, congratulations also to the Vice Chairperson of the National AIDS Council, Mr. Philip Moses. Which one of you, if you want to say a few words, and then we'll finish off with the chairperson.
My name is Tendai Westerhoff, and thank you, our new chairperson, and the whole NAC board, the deputy minister, and all protocol observed. We would like to see this board work towards effectiveness, rebranding NAC, a board that is honest and transparent in all its dealings, and above all, the greater and meaningful involvement of people living with HIV in the national response. I'm talking about their involvement in program planning for NAC activities, in program design, in program implementation, and in program monitoring and evaluation. We want to ensure that the communities that we serve will make a change. If there is no treatment elsewhere, treatment should reach the most vulnerable person on the ground and in the most vulnerable community. We would also like to see the whole issue of prevention of new infections. Now that we are working towards ending HIV and AIDS, and we now have the COVID epidemic on the block. So prevention of new infections is important among people living with HIV, and ensuring that they are involved in treatment, care, and support, and they get the best quality. So I'm so happy with this opportunity to all my board members. We look forward to working as a team and to support the work of the ministry and the work of the government entrusted upon us. Thank you.
Philip Moses.
Your Honorable Minister, the Chair of the NAC Board, I'm very pleased, that the ministry and the government have nominated and approved my membership for this board. I am hoping that the whole field of HIV and AIDS, will take a new turn with a new board that is coming into effect. All the people that are here have very specific and specialized skills in their own areas. I, for myself, am a behavioral scientist, and I hope I will be able to improve the programming, especially to ensure that the quality of the programs, specifically the psychosocial programs, are in line with the best practices elsewhere, all over the world. And having worked in HIV/AIDS for a very long time, I hope that during the next 5 years, through the contribution of this board, we should see nearly the end of the HIV/AIDS pandemic in Zimbabwe.
We want to thank you, Minister, for appointing us. We're not expecting this, but now we are there. As a board, really, what I want to promise you is we will have listening ears. We will have open eyes to see what is going on. Because in the fact that you are appointed, it doesn't mean to say you are the best. But we are going to be learning, and we are going to be learning from all of us. If you see something not going well, I hope Wanaeke, who has been there for a long time, will always say maybe you need to look at other things. Right now, we have a problem of the COVID-19. This was not anticipated. Then we need now to say, okay, what effect does it have on the HIV and AIDS. And what are we doing after? Because even when this stairway ends, we're still going to have a lot of problems coming up. And again, in most cases, those who fund us may now even say, now that we have COVID, we can't fund HIV and AIDS. But then we'll be creating a problem that will be accumulating to be a big one afterwards. So we need actually to continue, and also we hope that even the funders that we have overseas, they will still continue to support NAC, and also will, as we say, our national funding must also increase. Because some of the funders always say, okay, we are coming with a plate full, but what do you have? We have to have something as a country also to be doing that. So I want to thank you, Minister, and wish you all the best, because I haven't seen you since you were appointed. Know that everything goes well. Thank you very much. Thank you.
Straightforward, as a board, we should remember the small sayings that none of us is as strong as all of us. So it really means to say we need to work as a unit. And the minister emphasized that you need to think outside the box, which means if you look at the horizon, you may think it's over. It's a limitation of your sight, not that there's nothing above there. So you really need to think beyond the horizon. And I would like also to remind the board, CEO and the chairman, that HIV disease or AIDS is a chronic disease which might be linked to other diseases that are killing people with AIDS, like diabetes, hypertension, hyperlipidemia. We should look at all of those. Of course, you mentioned the COVID. So I see there are many researchers. People need to look into those so that we don't save people from AIDS and they later die of diabetes or hypertension, and its relationship to the common cancers. These are chronic diseases which must be encompassed and work together with relevant departments. I want to thank you all, and we hope the next 4 years will be lovely and we'll be working together nicely. Thank you.